Hello there. For those of you who don't know me, my name's Linda, and I've been a natural health therapist for just over 30 years now. And I'm also the brand founder of the Just for Tummies range of digestive, gut, bladder, and vaginal health supplements. And today I want to speak to you and explain why I decided to develop a probiotic capsule specifically for women. So these are the capsules, as you can see. I've given them the name for women. We like to keep things simple and straightforward at Just for Tummies. And a pot contains 60 of these capsules. I developed the initial range several years ago that consists of the live bacteria probiotic capsules, the natural digestive enzyme tablets, the activated charcoal capsules, the high-strength omega-3 capsules, the garlic tablets, the fiber tablets, and the milk thistle tablets. So that was the initial range. And I developed that range based on my many years in clinical practice and sorting out the wheat from the chaff in terms of the best ingredients that I knew helped to reduce common symptoms of irritable bowel syndrome, painful bloating, trapped gas, constipation, acid reflux, but also to help improve the immune system. I could talk at great length about the connection between the gut and the immune system, but that's not what today's talk is about. Today's talk is about why I developed a specific probiotic for women in particular. So going back a few years, I'm qualified in several different complementary therapies, but my main complementary therapy discipline became colon hydrotherapy. So I would be working in my clinic 5, very often 6 days a week, long days, carrying out colon hydrotherapy treatments, mainly on women who suffered with the aforementioned issues. Irritable bowel syndrome symptoms, common ones are bloating, painful trapped gas, constipation, and acid reflux, but also the management of diverticular disease. And women also liked to come for colonics because they felt that it improved their skin, and it certainly does. So why did I decide to develop a probiotic for women? Well, what happened one day, a lady came to see me and she'd been recommended to have colon hydrotherapy by her gastroenterologist. And this particular lady suffered with chronic constipation, and she had done for many years. And she'd tried lots of different laxatives, the strongest laxatives that you could get. She'd tried enemas in hospital. They tried to clear her out with enemas and nothing worked. And the only thing left to the medics was to carry out manual bowel evacuation. And that's where someone goes under anaesthetic into the operating theatre, and the medics actually remove the impacted feces from the rectum. They glove up and they pull the feces out. They couldn't perform this particular procedure on this lady because she had developed antibiotic resistance. And with manual bowel evacuation, antibiotics are often required following the procedure because there's an increased risk of having an infection. So they would always give prophylactic antibiotics. This lady couldn't have any antibiotics because she was antibiotic resistant, so the antibiotics just wouldn't have worked on any infection that she got. And I was just intrigued as to why she'd developed antibiotic resistance in the first place. But anyway, we got on with the colon hydrotherapy treatment, and it took around 3 colon hydrotherapy treatments to completely clear her out of all this impacted feces in her bowel and to give her some welcome relief from that, because she was literally being poisoned by her own bowel wastes. So when I had her on the couch and we were carrying out the colon hydrotherapy treatment, I asked her, I said, why have you developed antibiotic resistance? And she went on to tell me that for many, many years, for decades, she'd suffered with urinary tract infections. And as you probably know, if you're a woman listening to this and you suffer with urinary tract infections, what does your GP do? He puts you on a course of antibiotics. And this lady had had multiple courses of antibiotics, so many that they'd made her antibiotic resistant, and probably had also caused the chronic constipation that she was struggling with, because antibiotics, as well as killing off the bacteria that causes an infection, like a urinary tract infection, antibiotics also kill off, decimate billions and billions of your friendly bacteria, both in your gut, in your bowels, so affecting transit time, but interestingly enough, the friendly or beneficial bacteria in your bladder as well. So they can also put you, taking antibiotics can also put you at risk of developing another urinary tract infection in the future. And when she was explaining to me how she'd become antibiotic resistant because of all these antibiotics that she'd been prescribed, I just remember feeling, well, I felt angry. I did. I felt furious. You know, the hairs on the back of my neck just stood up because I felt so sorry for this poor woman who now found herself in a situation where a simple infection had the ability to kill her because there were no antibiotics available to kill the bacteria that was causing that infection. And also the fact that she suffered so dreadfully with chronic constipation. And when constipation gets that severe, where impaction gets that severe, there is always the risk of it causing a bowel perforation. And that can be fatal if it's not, if surgery doesn't correct it in time, because septicemia would set in quite quickly. And so I remember thinking at the time, right, that's it. I've developed the core range of the Just for Tummies supplements, but I simply had to do something that helped women like this lady manage UTIs better. Because if you can nip things in the bud with a UTI, if it's your first UTI or maybe your second UTI, to stop getting on that merry-go-round of a UTI, antibiotics, a few weeks later, another UTI, another set of antibiotics. To stop that, I wanted to intervene early with a strain-specific probiotic that contains a capsule. I'll show you the capsules, they're really tiny, that contains specific strains of friendly bacteria that have been proven to help reduce urinary tract infections and, incidentally, thrush, vaginal thrush, caused usually by antibiotics and bacterial vaginosis. So that's the capsule. It's really, really tiny. Okay. So this contains 3 different types of friendly bacteria. So I included the Lactobacilli reuteri because that's the one that in studies has been shown to help reduce urinary tract infections. But because my speciality is the successful management of irritable bowel syndrome, painful bloating, trapped gas, constipation and acid reflux, I also decided to include 2 extra strains of friendly probiotic bacteria, and that they were Lactobacilli acidophilus and Lactobacilli rhamnosus. And I've also put a little bit of vitamin C in there to support immune health as well. And so we launched our For Women capsules about a year after launching the initial range. And you can go onto the Just for Tummies website and you can click on the page, the shop page for the For Women capsules, and you can read some of the amazing reviews we get from women whose lives have turned around for the better as a result of taking our For Women probiotic capsules. And I always recommend taking one of these capsules before breakfast and one before bed with a small glass of water, not with hot drinks. And if you do have a strong gag reflex where you find it difficult to swallow capsules, even though these capsules are really, really small, yeah, they're really, really small. You can actually open the capsule. I'm not going to demonstrate it now because I don't want the powder all over my keyboard, but you can open the capsule and sprinkle the powder into a cold drink, into yogurt, onto cereals. So that's the story behind my For Women probiotic capsule. So many women, they take these capsules twice a day, not just because they want to reduce their risk of getting a urinary tract infection, but also, and if you read some of the reviews on the shop page on the website, also they help reduce common symptoms of IBS, in particular bloating. They help to regularize bowel movements. They help to reduce painful trapped gas. And of course, like any probiotic, when you understand the connection between gut health and the immune system, around 70–80% of your immune health, your immune cells are produced in your gut. So when you understand that connection, then these probiotics also help to give you a more resilient and stronger immune system. And I think we all agree the importance of that after what we've all recently been through for almost 3 years now. So yes, those are my For Women capsules. That's the story as to why I developed them. And if you want any more information about the For Women capsules or any of our supplements, of course, then don't hesitate to message us, or you can drop the Tummy team an email, feelgood@justfortummies.co.uk. Thank you for listening, and bye-bye for now.